So let's start talking about IgG4 related disease first. IgG4 related disease is a chronic lymphoproliferative disorder. So lymphocytes anywhere in any of the body cells, if they proliferate and it's a chronic process, it could be an IgG4 related disease. And the antibodies that actually proliferate and lead to tissue lymphocytic proliferation are IgG4 antibodies. So that becomes very specific. It is very important for your AIIMS PG exam. NEET PG also, the biopsy findings of IgG4 related disease have been asked previously twice. But for INICET, this becomes all the more important because this is one diagnosis which is usually ruled out in a patient of generalized lymphadenopathy, a patient of thyroiditis, a patient of COX not responding to anti-tubercular treatment, a patient of diabetes insipidus. So these are the things that are usually, these are the symptoms or syndromes that usually patient presents with, and we try to rule out IgG4 related disease, or we suspect IgG4 related disease. Okay, so let's start. So if we start from head to toe, hypothalamus and pituitary. So involvement of hypothalamus and involvement of pituitary. So involvement of hypothalamus can lead to a central diabetes insipidus. Involvement of pituitary can lead to a pituitary mass. So a cellular lesion. A pituitary mass means a cellular lesion. If we talk about eyes, then whenever there are eyes that are involved, there is an inflammatory disorder. We are talking about one part of the eye globe that is getting involved. So we know that in SLE, RA, it's the sclera, scleritis, episcleritis are the more common findings, and in sarcoidosis and ankylosing spondylitis, it's the uveitis. But what is that one part of eyeball or the eye globe that gets inflamed in IgG4 related disease? That one part is dacryocystitis. So the tube, so dacryocystitis, and it can also present with an orbital pseudotumor. Pseudotumor. Now we talk about salivary gland. So salivary gland involvement is known as Mikulicz syndrome, which can present like Sicca syndrome. So dry eyes, dry mouth, secretions में problems होना. So Mikulicz syndrome. If we talk about aorta, then aortitis, which can present with chest pain, and aortic dissection again can present with chest pain and a life-threatening presentation also. That can be there. If we talk about the lymph nodes, the cervical lymph nodes, the axillary lymph nodes, the hilar lymph nodes, chest lymph nodes, mediastinal lymph nodes, so generalized lymphadenopathy, it can present with generalized lymphadenopathy, even the inguinal lymph nodes. Okay, so generalized lymphadenopathy. Let's talk about kidneys. So TIN, tubulointerstitial nephritis. Now there is thyroid in the neck, and the involvement of thyroid is known as Riedel's thyroiditis. We'll try to remember this. Pancreas, autoimmune, type 1 autoimmune, pancreatitis and obstructive jaundice. So these are the findings that can be there. In CNS, there can also be a meningeal involvement. So meningitis, aseptic meningitis. Right, so one of the differentials of aseptic meningitis is IgG4 related disease. So we'll try to remember all of these. We'll try to remember from head to toe. There can be a central diabetes insipidus, there can be a cellular mass lesion, there can be aseptic meningitis, then there can be dacryocystitis and orbital pseudotumor, Riedel's thyroiditis, aortitis, aortic dissection, Mikulicz syndrome involving the salivary glands, which is similar to Sicca syndrome, a generalized lymphadenopathy patient, tubulointerstitial nephritis type 1, autoimmune pancreatitis and obstructive jaundice are the common findings of IgG4. Now, this is not what is usually asked in exam. What is usually asked? In exam, a patient presentation will be there that the patient of generalized lymphadenopathy also has type 1 autoimmune pancreatitis or Reeder's thyroiditis or a thyroid involvement. And what are the biopsy findings that you are suspecting? So the biopsy findings become important. So let's talk about the biopsy findings. Now, the biopsy findings of IgG4 related disease can be remembered with the mnemonic DOSE, D-O-S-E, DOSE. Okay, so we have all the medicines have doses. So DOSE. So D stands for dense lymphocytic infiltrate. So on the biopsy you find dense lymphocytic infiltrate. D. O for obliterative arteritis. So you can find small, minor, small clots in these small arteries or the vessels in the biopsy. Right, so obliterative arteritis. S stands for storiform fibrosis. Storiform means flower-like. So there is a flower-like fibrosis finding. So storiform fibrosis. And E stands for eosinophilic infiltrates. E stands for eosinophilic infiltrates. In Harrison's, there is a very good figure that is given. You can try to remember that image. So please try to remember dose. Now, what is the treatment of IgG4? The treatment of IgG4 are steroids, and the steroid sparing agent that is usually used is rituximab. The steroid sparing agent that is usually used is rituximab. So try to remember all the biopsy findings, the clinical features and the treatment. The steroids, rituximab. That's it. This is all you need to know about